COVID-19 in Utah. That makes 28 people who have died now. You can see on the chart on the upper right of your screen, the health department estimates nearly 800 patients have recovered, however. Utah has tested more than 68,000 people. More than 3,200 of those tests have come back positive.
What we really are going to start looking for is a decrease in that positive rate. So maintaining our testing capacity, maintaining our ability to test those who have mild symptoms, and then also starting to see a decrease in the positive rate. And that'll be a really good indicator that we're kind of getting towards on the other side of the curve and starting to see a decrease.
Dr. Dunn says Utah is seeing a flattening of the curve. She adds they are preparing for a second wave of COVID-19 in the fall, saying it doesn't mean it is definitely going to happen, but is something they will prepare for.
In the plan to reopen the economy, state leaders suggest customers could dine inside restaurants by as early as the first half of May. And when that does happen, it won't be like you remember. Restaurant staff will likely be wearing masks, and there will be limits on the number of people allowed inside to allow for social distancing. But some physicians say lowering health orders in May is not only irresponsible, it's deadly.
The control of this, both from the standpoint of the economy and public health, should be dictated by the real experts, and that's not politicians.
A recent study by epidemiologists with the University of Washington surveying different regions of the country say Utah would be safe reopening in June or early July.
Utah scientists hope to determine COVID-19 infection rates by testing sewage. The Department of Environmental Quality has launched a pilot program with multiple wastewater treatment facilities and 3 Utah universities. They hope data from the sewage will provide answers for coronavirus infection rates in a given community and show signs before new outbreaks.
One of the benefits of monitoring the sewage is that if we start to see a resurgence, we're going to be able to detect that sooner. We're going to be able to see it in the weeks preceding before it becomes a greater problem.
The pilot program is expected to run for 3 weeks. The DEQ will give the data to health officials to see whether it's an effective way of determining infection rates.
We really had some